Today, we're proud to bring you Zoom Advanced Power. It's the fastest, most effective whitening system ever. Zoom Advanced Power is a complete system that gives your patients immediate results and ensures lasting effects long after the whitening treatment. The Zoom Advanced Power lamp was specifically engineered to activate Zoom's advanced formula whitening gel for superior whitening results. Simply stated, Zoom Advanced Power is better than ever. 50% of patients whiten to B1 or better in just 3 short 15-minute sessions. This video is designed to provide comprehensive instruction on the Zoom chairside system for all staff involved with the treatment, either as the operator or support. Please review the video in its entirety and complete the corresponding documents in order to complete your Zoom chairside training certification. Here is what you... Impressions should be taken at the consultation appointment. It is recommended that the custom whitening trays be ready at the end of the Zoom appointment. Preferably, the enamel should be free of moderate to heavy plaque and calculus buildup. A cleaning or prophy with flour pumice prior to whitening appointment is recommended. Patients that require root planing should wait 2 weeks before their whitening treatment. Document the starting shade in the patient's chart and, if possible, photograph the patient's teeth with the proper shade tab in the photo for reference. As noted in our instructions, patients with yellow staining tend to whiten best. Patients with severe staining and banding will require additional follow-up take-home or further chairside treatment to obtain satisfactory results. Break open the end of the swab applicator at the line to release the solution into the tip. Apply 1 swab to the top and bottom arch. The solution does not need to dry. The whitening gel may be applied immediately. Extrude the gel into a dappen dish or onto a mixing pad. Use the brush supplied in the kit to stir the gel and apply it to the teeth. Apply the gel to the facial area of all visible teeth, approximately 1 to 2 millimeters thick. Activate the main power switch located on the side of the power supply module. The dash side of the button should be pressed for the unit to be in the on position. Adjust the back of the chair to a comfortable position, approximately reclined 30 degrees. This is the easiest position for lamp placement, but adjust appropriately for patient comfort. Attach the light guide to the lamp. The lamp will not turn on if the light guide is not in place. The display will read Guide Status, Guide Attached when the light guide is attached, and will then read X of X sessions, press Start. The number of sessions can vary based on the kit type. The light guide is designed to ensure proper distance to the light and maintain light exposure to the smile zone. Slide the lamp into place next to the patient. Position the lamp head to the patient's smile zone, aligning the slots on the light guide with the retractor. Place the end of the retractor into the slots located on either side of the light guide. Press the Start button on the display panel to turn on the light and activate the timer. It will begin the 15-minute countdown. It is normal for the light to flicker for the first few seconds. Be sure to check on the patient regularly during this period. If you plan to leave the room for an extended time, provide the patient with a means to contact you, such as a small bell. It is also helpful to have a paper and pencil available in case the patient needs a means of communication. Point out to the patient that the progress of each session will be tracked by 4 lights on the top of the lamp head. A light will appear for each 25% of the session. These lights are also helpful for checking on the patient's progress and time remaining. The lamp will beep once when 3 minutes are remaining and again 3 times on the final 3 seconds of the cycle, with 1 long beep when the time reaches 0. The light will automatically turn off when the cycle is complete. Remove the light guide from the retractor. Gently pull the lamp away from the patient while maintaining the vertical position. Carefully remove the gel with suction and/or wipe the surface of the enamel clean with damp gauze. Take care not to dislodge the isolation materials. Do not irrigate. The force of the water may pull the dam loose and saturate the isolation materials. Check the isolation materials to ensure they are intact and no pink is visible. If the patient notes sensitivity at the margin due to tissue oxidation, open the vitamin E oil and use the brush to apply the oil to the sensitive area. The vitamin E will help to soothe the tissue and act as a barrier against further gel contamination. The vitamin E oil may be applied to any tissue that has had contact with the whitening gel and may be sensitive or has turned white from the oxidation. Apply the starter swab to the top and bottom arches as before. Bleed the syringe to remove the oxygenated gel and ensure a fresh mix. Extrude the fresh gel into a dappen dish and apply as before with the enclosed brush. Use horizontal movement to reposition the light. At the beginning of each session, note that the number of sessions remaining has been reduced. Attach the light guide to the retractor and press the start button to activate the timer. Repeat these steps for each session to complete the whitening procedure. Remove the light guide from the slots and gently pull the lamp from the patient. Slide the lamp out of the way. Suction or wipe the gel from the teeth. Use damp gauze to remove the residual gel. Use the cotton pliers to grasp the gauze isolation and gently pull. All of the isolation material should pull free from the mouth in one unit. The retractor should remain in place. If the gauze is excessively dry, moisten it lightly before removal. Completely rinse the teeth and irrigate the oral cavity. If liquidam remains interproximally, remove with floss. Lightly use air to remove remaining material. Now it is time to judge the initial whitening results. With the retractor still in place, use the shade guide to determine the after shade. Document in the patient's chart and with a photograph. Review the post-treatment care instructions with the patient and provide the card included in the kit for reference. Explain to the patient that the teeth are more susceptible to restaining over the next 24 to 48 hours. The teeth may continue to lighten during this period, and the patient must be careful not to consume any staining foods or beverages. Syringe the satin finish potassium nitrate and sodium fluoride gel into the completed take-home trays and seat them on the patient. We recommend a minimum initial wear time of 10 to 15 minutes. A complete application requires approximately half of one syringe. If the trays are not ready, syringe the satin finish directly onto the teeth. Dispense the take-home whitening gel for maintenance care to the patient. The remaining satin finish gel or a desensitizing product such as Relief ACP can also be dispensed to the patient at this time. The light will not turn on if the light guide is not in place. The display will continue to read "Attach Guide." Use of the light guide is mandatory to maintain proper distance to the light and maintain positioning at the smile zone. Always cure the liquidam in a sweeping motion. If the light is held in one position too long, the material can heat up, causing discomfort to the patient. Curing in a sweeping motion allows for proper cooling of the material. Once the isolation is complete, always check the margins and interproximal coverage of the liquidam, especially on your blind side. Remember, no pink. Marketing. Now that you've completed this Zoom training, you're ready to let existing and new patients know they can have a brighter, whiter smile in less than an hour. For more information about marketing Zoom to current and potential patients, call your sales representative.